Good morning and good afternoon. My name is Tracy Rabin, and I'm Associate Professor of Medicine at the Yale School of Medicine and Graduate Medical Education Director for Global and Community Health Education at Yale New Haven Health. And I'm excited to speak with you today about my WomenLift Health Leadership Project, Reclaiming a Sense of Purpose in Health Professions Education, Transforming Learning at the Intersection of Global Health and Health Disparities. Now, my work is really at the intersection of two evolving fields, global health and medical education. And global health as a field has had this evolving focus on health equity issues that are not geographically bound. And importantly, it has been developing in parallel to a domestic health disparities field. Although both exist in silos in academia, there is an emphasis in both fields on social determinants of health, community engagement, and then advocacy for health. Now, medical education has also had an evolving focus on tailoring care towards diverse community and patient contexts. And as a result, has been incorporating more elements of what I term local global health pieces into the training standards, specifically an emphasis on social determinants of health, community engagement, and physician advocacy for health. And so my leadership project has two areas of focus. The first focus is on reviewing national standards for graduate medical education that relate to global health. The Accreditation Council for Graduate Medical Education, or ACGME, is the national body that has developed competency-based developmental outcomes frameworks for our training. So the ACGME milestones is what they're known as. And these are designed to evaluate trainee knowledge, skills, attitudes, and practices to assess the training progress of doctors who have completed medical school. So now the second portion of my leadership project is to assess whether and how these standards are being met by the 26 different residency programs at my institution, all in different fields. And in the process of assessing these standards, we'll be developing a generalizable rubric that hopefully will be used by other academic institutions to look at their own programs. And so my leadership project has four phases. The first is to review the ACGME milestones as written for the 26 different residency programs that we have at Yale. The second is to develop a survey to capture the local global health learning activities that are currently ongoing at these residency programs. The third is to develop a framework for key considerations to be incorporated into local global health curricula. Ideas like thinking about sustainability of relationships and having more of a focus on equitable partnerships between academic institutions and community organizations. And then the fourth phase of my project is to work with the leadership of the various residency programs to co-develop curricular interventions that will allow them to help trainees better meet these milestones. Now, at this point, unfortunately, my project is still in the first phase. And I'll tell you a little bit about some of the factors that have affected my project implementation. So first, the challenges. There have been some issues related to support team engagement. Specifically, in summer 2024, I had hired a student to help work on the ACGME milestones review. However, as she was an undergraduate, we had to spend some time initially giving some background information about graduate medical education and how the milestones were developed so that she could fully understand and engage in the project. Now, unfortunately, by the time we completed that portion of her time working with me, she had other competing priorities that were more important. And so she wasn't able to complete her work in the summer. And then it wasn't until November of 2024 when I was able to hire another student to work with me on this project. However, everything has started off really well with this student, and I expect that we'll be working together into the future on this project. Now, ordinarily, I would have just taken on the bulk of the work and the review myself. However, I had some additional teaching responsibilities that I needed to take on in fall of 2024. Now, however, there have been some facilitators that have been really helpful in terms of thinking about the implementation of this project. So namely, the Yale School of Medicine launched a new strategic plan for medical education in 2022, which incorporated a longitudinal health equity thread, and also emphasize the goal of increasing mutually constructive community engagement, which has really elevated this conversation amongst the faculty and helped in terms of getting buy-in from various stakeholders in the residency programs. The second is that I've had more time to be in this GME director role. So my role with respect to global and community health education across the training programs was brand new in 2022 when I took it on. So after 2 years, I've had some increased visibility. The residency programs have developed more of a sense of what it is that I'm focusing on, which has also helped with potential buy-in. And so the timeline has been updated a bit. And so at this point, I anticipate that we will complete the review of milestones by the end of Q1 2025. We'll be working on developing and implementing the survey in Q2 and 3 of this year, and concurrently be developing the framework for key considerations in local global health curricula. And then lastly, I anticipate being able to start co-developing new curricular interventions in Q4 of this year and then moving on into the future. Thanks so much for listening to me sharing about my project. I look forward to answering your questions. Thank you.